The chiropractic program has been in place since 1911. It first started as Los Angeles College of Chiropractic, and later Los Angeles College of Chiropractic has become SCU. We still have the Los Angeles College of Chiropractic within SCU, and we carry that with a lot of pride. And with all this tradition, LACC has been really focusing on graduating students that are concerned not only with what's the matter with the patient, but really what matters to the patient. LACC has been in place since 1911, so we have graduated hundreds of thousands of chiropractors that are working all over the country and all over the world and helping all the patients with all the help that they can give them. The Doctor of Chiropractic program is a 10-term program, but we also offer a 12-term option, which is also required for our students that get to the program as an AATP student. In the first year, the students are going to have a lot of their basic sciences or foundational health sciences. So anatomy, physiology, functional anatomy, biochemistry, all that's going to prepare you for your next phase. Since the first week of your program, you're going to have the opportunity to have skills lab and diagnostics labs. And during those labs, you're going to be practicing your palpation skills, finding landmarks, understanding how to approach the patient, how to position the patient in the table. At the same time, you're also going to be learning how to evaluate the patient, getting their vitals, interviewing skills, and other skills that are going to be needed when you get to your clinical phase and start seeing your real patients. During year 2, it's going to be really fun because then you're going to be able to really practice the adjusting skills. So you're going to be learning how to adjust the cervical, how to adjust the thoracic and lumbar spine, how to adjust extremities, and all of that is going to help you learn how to manage your patient, how to treat your patient, and be ready for your clinical phase. Then in the last phase of your chiropractic program, you're going to be in clinic. You're going to be seeing patients. You're going to be focused on learning how to approach a real patient and how to treat your real patient. So with the help of your supervising clinician, you're going to be seeing patients of the community. So you're going to be able to get a real patient, interview them, find a diagnosis, decide what the management plan is going to be with your clinician, and then treat the patient as appropriate. In addition to that, our students, they rotate through more than 10 clinics in our program. So we have a lot of opportunities to see a variety of patients and the specific number of patients that you want to see. One of the biggest strengths of our program is the opportunity for the students to customize their experience here. So we have a portion of the program where the students are required to take selectives classes. Those selectives will help the students to prepare for when they graduate and they want to go out in the field. We have a great variety of courses that the students can select from, and the students use this opportunity to personalize their experience. So for example, students who want to focus on sports medicine, we have more than 15 courses that students can select from, so they can take those courses as part of their curriculum here. We also have courses in pediatrics, taping. We have courses specifically on chiropractic techniques. We have courses specific on management, business, yoga, Ayurveda, acupuncture, and many other courses that will provide you the opportunity to really focus on what you want to do when you graduate. The sports medicine selectives help the students to focus on the sports medicine area. So there are many courses that the students can take. Some of those courses are focused on sideline skills, or can also focus on concussion, or can focus on preparing the athlete to be ready for their competition, or helping the athlete recover from their competition. There's so many areas that they can focus based on those sports medicine selectives that I think it's a great way for the students to personalize their experience and be ready for when they graduate. And while in the program, the students have the opportunity to use many technologies and many resources we have here on campus. We have a cadaver lab. We also have 3 chiropractic rooms like this one you're seeing. We also have our clinic here on campus, which we have 2 of them, plus all the other clinics off campus. The students also have the opportunity to use technology. So we have a FSTT lab, which is a lab that has a very specific table where students can learn about how are their adjusting skills going. So it's a very specific table that shows them how their speed, their direction and their force of the adjustment it shows on a screen, so it's really nice to see how that helps the students develop their skills. We also have some software that help our students develop their skills and prepare not only for their classes, for their program, but also for their national boards, which is a very important exam that the students need to take in order to license here in the United States. One of the differentials at LACC is our whole person health approach. So the most important thing for our students is not only what's the matter with the patient, but really what matters to the patient. So if you're seeing a patient, two patients that have the same age, same gender, same diagnosis, they don't have the same backgrounds. So the way to approach those two patients is totally different, and that's where we focus that on our students. What's the goal for each one of those patients, and how can we approach those patients with a different treatment that will meet their goals? So the way we do that is when the patient comes in, we're not only palpating their back and asking questions about their previous history, but we are also asking questions and investigating, again, what's important to that patient. The other advantage for the chiropractic program is that we have a low in-person residency program, which means that you don't have to be on campus every day of the week. This allows the students to only having to commute to campus when they need to. Sometimes it's 2, maximum 3 times a week, which means that they can study from home, they can plan their week according to when they have to come to campus and when they have classes. The majority of our online classes are synchronous, which means that the class starts at certain time and finishes at certain time, which means you're going to be committed to that time, but not necessarily you have to come to campus for that. We welcome you here to SCU and LACC, and we are very excited to help you with your journey to become a chiropractor.